In this video, we are going to show the procedure of laparoscopic cystectomy in a big ovarian cyst. This young unmarried girl presented with swelling in the lower abdomen, and per abdomen it was 28 week size. Cancer markers were negative. MRI showed a unilocular huge cyst, and this was the 28 to 30 week size mass in the lower abdomen. After reasonably ruling out the risk of cancer, we decided to go laparoscopic approach. On laparoscopy, one can see there is a huge cyst and there was torsion in the cyst, so it was detorted as she was, and then to reduce the risk of spillage, direct trocar insertion was done through which suction was put in and the cyst was aspirated completely. And then for frozen section, a piece was taken and again a suture was put in. This is all to reduce the risk of spillage. Then a bag was inserted, cyst was inserted inside the bag, again to reduce the risk of spillage, and cystectomy was proceeded with. This is dilute injection of pitracin in the remaining part of the cyst where the ovary was there, and to scoop out the cyst completely from the remaining ovary. So being in the correct layer, this is the procedure of removing the remaining cyst wall. So complete removal of cyst wall was ensured. After that, with the help of 2,0 Vicryl, ovary was reconstructed. One can see good amount of ovarian tissue could be saved in spite of this huge cyst. So the ovary was reconstructed. In another cyst bag, the cyst was put in again to reduce the risk of contamination on the abdominal wall. After that, with 3 liters of saline, thorough lavage was done and patient had uneventful recovery. Thank you.